Annually, an estimated 1 in 1,000 men develop epididymitis, and acute epididymitis accounts for more than 600,000 medical visits per year in the United States. In this video, we will talk about this disease, epididymitis, by answering these questions. What is epididymitis? What are the types of epididymitis? What causes epididymitis? Symptoms of epididymitis. How is it treated? What is epididymitis? Epididymitis is an inflammation of the coiled tube, called the epididymis, at the back of the testicle. Males of any age can get epididymitis. Epididymis is a narrow, tightly coiled tube that is attached to each of the testicles, the male sex glands, that produce sperm. Sperm cells, male reproductive cells, move from the testicles into the epididymis, where they finish maturing and are stored. What are the types of epididymitis? Epididymitis are divided into two types: acute, sudden, epididymitis, and chronic, long-lasting, epididymitis. Acute, sudden, epididymitis. This is when your symptoms develop suddenly and get worse. Acute epididymitis is usually the result of a bacterial infection. Chronic, long-lasting, epididymitis. This is when you have discomfort or pain for 6 weeks or longer. The discomfort or pain may go away and come back. The symptoms are usually less severe than acute epididymitis. What causes epididymitis? Epididymitis is often caused by an infection like gonorrhea or chlamydia. For over 35-year-old men, the most common cause of epididymitis is the backflow of infected pee, urine, down your ejaculatory tract to the epididymis, which is associated with E. coli. Men who have sex with men also have an increased risk of epididymitis from exposure to gastrointestinal bacteria, such as E. coli 2. Other less common causes of epididymis include a blockage in your urethra, an infection in your prostate gland, prostatitis, using a urinary catheter, like a Foley catheter, an injury to your groin, the arrhythmia medication amiodarone. Symptoms of epididymitis. Symptoms of epididymitis might include a swollen, discolored or warm scrotum, testicle pain and tenderness, usually on one side, that often comes on slowly, pain when you pass urine, an urgent or frequent need to urinate, discharge from the penis, pain or discomfort in the lower abdomen or pelvic area, blood in the semen, less commonly, fever. How's it treated? Epididymitis treatment depends on the cause. If you have an infection, you'll usually be given antibiotics. Depending on the cause of the infection, you may be given antibiotic injections or tablets, or a combination of both. The most common medications include doxycycline, ciprofloxacin, levofloxacin, trimethoprim. Most people need to take antibiotics for about 1 to 2 weeks. In rare cases, you may need a prolonged course of antibiotics. Guidelines from the Centers for Disease Control and Prevention, CDC, recommend the following regimen for acute epididymitis most likely caused by sexually transmitted chlamydia and gonorrhea: ceftriaxone 500 mg in a single dose plus doxycycline 100 mg orally twice a day for 10 days. For acute epididymitis most likely caused by sexually transmitted chlamydia and gonorrhea and enteric organisms, egg, in men who practice insertive anal sex, CDC recommendations are as follows: ceftriaxone 500 mg in a single dose plus levofloxacin 500 mg orally once a day for 10 days. For acute epididymitis most likely caused by enteric organisms, egg, cases that develop after prostate biopsy, vasectomy, and other urinary tract instrumentation procedures, with sexually transmitted organisms ruled out, CDC recommends levofloxacin 500 mg orally, once a day for 10 days. Weighing greater than or equal to 150 kg should also receive 1 g of ceftriaxone. If tuberculosis causes epididymitis, a healthcare provider may prescribe isoniazid pyrazinamide rifampin, ethambutol, rifapentine. Most people need to take anti-tuberculosis medications for 6 to 9 months. In severe cases, a surgeon may need to remove one or both of your epididymides, epididymectomy, or testicles, orchiectomy. If the arrhythmia medication amiodarone causes epididymitis, a healthcare provider may reduce your dosage or prescribe another medication. Talk to a provider before you adjust or stop taking amiodarone. Can epididymitis be prevented? You can help reduce your risk of epididymitis by using condoms during sexual intercourse, regularly washing your hands with clean water and soap, covering your mouth when you sneeze or cough, staying up to date on vaccines. Other treatments include aspiration and sclerotherapy, though these are rarely used. During aspiration, a special needle is inserted into the spermatocyst, and fluid is removed, aspirated.